Okay guys, next we'll do the posterior segment of the upper lobe, which will start at the spine of the scapula, and remember it kind of tapers out a little bit. So again, for this, we'll use our surface anatomy. Again, if our patient has a sports bra on, we can either listen right over it. That's completely fine. So we have Juliet here as our model. Juliet, is it okay if I listen to your lung segments here? Okay, great. So again, we're going to find our spine of the scapula, roughly about T3. And we're just going to come slightly lateral here because it tapers out. So we'll find it. And Julie, can you give yourself a hug and just move the scapula out of the way? Great. So again, if there is a little bit of clothing there, we can slide over it or just a little bit under it, depending on the patient's comfort. And we'll listen over for Juliet. Can you take a breath through your mouth? Always listening left to right, or right to left. Just always listen bilateral. Great. All right, so that is the posterior segment of the upper lobe.